Oncology Reordering Labs Workflow. There are potentially multiple reasons the oncologist may need to reorder labs for a patient. In this scenario, let's say that the patient has arrived for cycle number 2 of treatment, and the nurse has contacted the physician to let them know that the parameters to proceed with treatment are not within range. The oncologist may want to check those parameters under results review. They could see recent labs if resulted within the VPP. However, for sites outside, they could also access their Care Connect to view these results. Once they had seen the results, they would go to the orders profile to look at the chemotherapy lab phase in question. The next question the oncologist would have to ask themselves is if all labs needed to be reordered. In this instance, let's say that they only needed to see a repeat CBC and differential. The oncologist would go to their provider view and access their orders page and simply select the order that they needed to reorder for this patient. Once they select the order, they would come to the shopping cart and click Modify. For this order, it is future stated, but the oncologist would have to say at what time point they wanted this patient to have this lab taken. So let's say from a week from today, they want them to repeat the CBC diff. They would select the date and sign the order. This requisition would then be given per local policy and procedure to the patient, depending if the patient was there or if they were mailing the requisition to them. Now let's say that the oncologist wanted to reorder all the labs that were in the next cycle lab phase from the PowerPlan. They would go to the orders profile from the table of contents and select the next cycle lab phase from the previous treatment cycle. The way these PowerPlans are built is that the cycle PowerPlan phase holds the labs for the future cycle. The oncologist would click on the lab phase. They could see that there are multiple labs that were ordered, and instead of placing each one of these as an ad hoc order, they could select to copy the day of treatment, and similarly, they would have to change the start date and time to reflect the date that they would want the patient to have these labs drawn. So similarly, we'll say they want them a week from today. They would say OK and click Orders for Signature and Sign. Once again, this would print a requisition that would be given to the patient per local policy and procedure, if requiring to hand it to them at that time if they're there, or potentially mailing it out to them. Now, this could also be done if the provider was not available to enter the orders. The nurse could go in and perform the same actions with the oncologist's name under as a telephone order, which would then send a message to the provider's message center, which they eventually would have to sign off and accept. That would conclude the Oncology Reordering Labs workflow.